Hey guys, welcome to UWorld's Next Gen NCLEX review. My name is Nicole. Welcome back. Sorry we are running a few minutes late. We had a couple of technical difficulties. We're moving things around, different room. But thank you guys for sticking around and joining us on another question drill today. Today's topic is prioritization. So everything think first, priority, most, critical. So things can get a little tricky, but we're gonna work our way through them, through these questions and figure out the best study and strategies to execute these questions. So let's first look at this slide so we can get some tips on how to answer these questions going forward. So first things first, when you see a prioritization question, they usually have questions with first, immediately, priority, or most. So the first thing to try to think about is to break it down into airway, breathing, circulation, your ABCs. This will kind of help you pick out the most and the prioritize which one you should assess first, because sometimes these questions can have like more than one right answers if it's a select all to apply, but you want to group the ones with the most correct answer. So the one with the A with airway or breathing would be number 2, or circulation, that's number 3. And then after ABCs, then we go into safety and infection, and then we follow the nursing process. So take a screenshot. Maybe this will help you guys figure out how to prioritize these next couple of questions. And then we'll move on from there. As well as let me know any study tips or helpful hints that you guys may use as you do prioritization questions in the chat. So, first question, the nurse has received information about assigned clients. The nurse should first assess the client with what? Option 1, peptic ulcer disease, who is reporting stool with coffee ground appearance. Option 2, diabetes mellitus, who is scheduled to receive metformin now. Option 3, heart failure and 2+ peripheral edema, who is currently eating lunch. And option 4, bacterial pneumonia, who is disoriented and diaphoretic. Let me know which one you think we should assess first, which is our biggest priority at the moment. I see some people putting some study tips of acute versus chronic. That is actually very good. If we're dealing with an acute situation rather than a chronic or history of type situation, acute would definitely want to be assessed first. So that's a good little study tip. Good job, guys. And lots of correct answers of option number 4, bacterial pneumonia, who is disoriented and diaphoretic. So with this, we're gonna think again, ABCs. Someone who is disoriented and diaphoretic. This is a person who also has bacterial pneumonia as an infection, but if they're starting to get disoriented, that means they're probably not getting a lot of oxygen to their brain. So that would be the B in the ABCs. And so that would be our correct answers. Options 1, 2, and 3 are probably less lower down on our hierarchy. Option 1, peptic ulcer disease, who is reporting stool with coffee ground appearance. This would be kind of going into the C of circulation with the bleeding, but since it's coffee ground appearance, that's showing that it's not an active fresh bleed, which would be bright red blood. So this one's not going to be a higher priority than a breathing problem or disoriented and diaphoretic. Option B, diabetes mellitus, who is scheduled to receive metformin now. This is like what that person in the chat was saying of chronic versus acute. This is a chronic condition, diabetes mellitus, and metformin is a maintenance medication that was used for diabetes mellitus in that chronic condition. So this would not be our priority right now. And then it's an expected finding. A client with diabetes mellitus would probably be getting metformin. And then option 3, heart failure with 2+ peripheral edema, who is currently eating lunch. There's nothing really triggering in this answer choice. 2+ edema is something that is, again, expected with heart failure and as a expected finding. So this is not our priority. Right now, we're going to be worried about someone who is disoriented and diaphoretic. But you guys did great. Next question. The nurse in the emergency department has collected information about clients waiting to be seen. The nurse should first assess the client who has what. So again, try to think of those tips that we were talking about and figure out which would be the highest priority and which you should assess first. Option 1, client with epistaxis, and takes aspirin. Option 2, dysuria and takes tamsulosin. Option 3, vomiting and reports frequent loose stools. And option 4, persistent cough and reports night sweats. Let us know. Oh, more tips. Stable versus unstable. That's also a good study tip. Great study tips. Good job, guys. As well as study tips, let me know what topics you guys are wanting us to go over. The new year, the new semester has started, so let us know, and maybe we can try to correlate with y'all studying with the semester with what we can go over here on live. As well as putting some great answer choices. We're getting a good mix of 1s, 3s, and 4s. So think about first ABCs or a client that is acute versus chronic. Let me know what you guys think. Oh, I got some study topics of medication administration. We went live this morning and there was a lot of people wanting some pharmacology. So yeah, now I'm seeing a lot of pharmacology requests coming in, and we'll do our best to start incorporating that a little bit more. But yeah, and again, a lot of mixtures of answers of 1, 3, and 4. So this one definitely is a little bit more tricky, but the correct answer is option 4, persistent cough and reports night sweats. So with these answers, you want to kind of figure out, if it's not blatant like epistaxis, what diagnosis they would be having. So epistaxis, it's giving you the diagnosis, and takes aspirin. Unfortunately, this would be a expected finding if you are taking the aspirin, which is an antiplatelet medication. So that would be a nosebleed. You would expect sometimes, unfortunately, to have a nosebleed. Dysuria and takes tamsulosin. So clients taking tamsulosin, this is a medication to help with BPH, to kind of relax the prostate so you can urinate. So the dysuria is expected with tamsulosin. And option 3, vomiting and reports frequent loose stools. My goodness. This is again an expected finding of what you would think with gastritis. You're gonna have stomach aches, you're gonna be having some diarrhea and some vomiting, but this persistent cough and reports night sweats, this is someone that probably is having or experiencing TB, which is a highly infectious infection and can spread very quickly. So after ABCs, you do expected and complications, but then you also think of infection that can spread very quickly. So a client with TB would be someone that we want to isolate and treat very quickly. So the persistent cough and night sweats would be our correct answer for this one. Let's move to the next one. I know that Instagram was down for a few seconds, so if you're just joining in, we are doing prioritization questions. So we're thinking of everything that needs to be done first, priority, most, expected. So thanks for joining in, and let's get to question number 3. You're not even halfway, you didn't even miss half of it, so you're just in time. The nurse is caring for assigned postpartum clients. The nurse should first assess the client who is what? So first, another first priority. Option 1 is rating incisional pain on a scale of 7, or as 7 on a scale of 0 to a 10. Option 2 is reporting pain with urination 3 days after a cesarean birth. Option 3 has a boggy uterus and is passing a large amount of lochia rubra. And option 4 has warmth and erythema of the right breast and a crack on the nipple. Let us know what you think should be assessed first. Good job, guys. Lots of good answers. Y'all are putting your answers in way quicker than I can actually read out loud. Y'all are fast readers and fast answer takers, or test takers. If you are new here, we do these lives every Tuesday, Wednesday, and Thursday. On Tuesdays, we hold lectures with Nurse Samantha, and then on Wednesdays and Thursdays, we do our question drills like this. And on Wednesdays, we go live at 2 p.m. and 3 p.m. Central Time, and on Thursdays, we go live at 11 a.m. and 3 p.m. Central Time. So join us every week. We have new topics, rotating topics. We'll start incorporating more topics like pharmacology. So let us know. Oh, lots of great answers. This one seems to be easy for you guys. Correct answer is option 3, has a boggy uterus and is passing a large amount of lochia rubra. Lochia rubra is bright red blood, and it's expected for postpartum client, but it usually slows down and decreases as the day goes by. If it lasts significantly more time after that and the uterus is still boggy, this would be a concern. So this would be the C in our ABCs. We're bleeding and puts them at risk for postpartum hemorrhaging. So we want to firm up that uterus by rubbing on the fundus and get that uterus to contract to stop that bleeding and to clot off everything that is going on in the uterus. Option 1 is an expected finding. If you had an incision, if you had surgery, you would normally probably have pain in that site. So again, not a priority. This is not who you would assess first. Again, number 2, reporting pain with urination 3 days after cesarean birth. Again, this can be or could be an expected finding if normally after cesarean birth you have a Foley. So sometimes you feel a little bit uncomfortable or it could be a UTI coming on. So again, an expected finding but not a higher priority than bleeding. And option 4, warmth and erythema on the right breast and crack on the nipple. This is showing signs of mastitis and infection, not a higher priority than bleeding. So good job, guys. That was very good. Next question. The nurse in the emergency room is caring for assigned clients. The nurse should first assess the client who has what? Lots of first. We're in the emergency room and we gotta know which client we're going to go see first. So are we going to see the patient that has a fever and a cough a productive cough of green sputum? Are we going to see the flank pain and is reporting hematuria for the past 3 days? Someone with photosensitivity and is reporting the worst headache of my life? Or are we going to see the swelling and limited flexion of the left patella or the kneecap? Let me know what you guys think. Good job. Lots of good answers. And my favorite question, now that we have Instagram back on, TikTok, YouTube, Facebook, everybody, let me know where you guys are tuning in from. It's my favorite question to ask. Favorite question that you guys love to chit chat and talk about where y'all are from. Let's see how far you world reaches today, as well as your correct answers, which there is a lot of correct answers already. Good job. We have someone from Miami. We have the Bay Area. So we have two sides of the US and Pennsylvania. Let's see if we have someone from like New Mexico. Let's get all 4 corners. Cape Town, South Africa, Canada, Turkey, in New Jersey and New York. Nice. The Philippines, Illinois, Alberta, Canada, Nigeria, Jamaica, Idaho, Ghana, Canada, New Orleans, LA, Philippines, Canada, Lebanon. Oh, but originally from Iran. Shout out to you. Nice to have ya. Kenya, Spain, Saudi, Haiti. Great. As well as putting in where you're from, I hope y'all are also putting in your correct answers. Haiti, Nigeria, from India, but currently in South Wales. Nice, guys. Welcome from all over. Love to see you guys joining in and getting ready for your NCLEX. Okay, correct answer for this one is option 3, photosensitivity, and is reporting the worst headache of my life. So Again, we're going to try to figure out what these symptoms are diagnoses of. So fever and productive green sputum, this is likely a respiratory infection. It's not giving us any signals that their oxygen level is low, it's just showing an infection. So that's not going to be our highest priority right now. Flank pain and is reporting hematuria for the past 3 days. Again, this is showing pyelonephritis, another infection, another thing that we definitely want to keep an eye on, especially since it is hematuria, but it's not gross hematuria, so it's not our priority at this moment. That's a C. Option 3, photosensitivity, and is reporting the worst headache of my life. This is concerning of increased intracranial pressure. Different than a migraine, you know, a migraine type of pain, it's kind of your usual, and you usually have symptoms before a migraine, but the worst headache of my life, that is significant of a brain bleed that could be happening from increased cranial pressure. So this would be our main concern right now, and B as well for bleeding. So we would want to assess that as well. Swelling and limited flexion of the left patella. This is showing expected findings of like a torn ACL. So not our priority at this moment. That definitely need to do a CT scan of this client that is having photosensitivity and that worst headache of their life, so we can get that stroke potentially under control. Next question. The nurse is assessing a 2-day-old client with Prioritization fellow. Which of the following findings would be a priority to follow up? So now we're looking at prioritization. So a lot of these are going to be correct answers and correct findings of Prioritization fellow, but which would be the priority to follow up on? Is it option 1, decrease oxygen saturation? Option 2, tires easily during feedings. Option 3, sleeps in 2-hour intervals. Or option 4, systolic heart murmur. Let me know what you guys think. Oh, and I see that we put some other, going back to the other question, what are other signs of increased intracranial pressure? We have confusion, vomiting, Cushing's triad, lots of good answer choices. So good job. Y'all seem to know neuro very well. Good job. Correct answers for this one. What do you guys think? Keep those answers coming. This one is pretty uniform across the board. The correct answer for this one is option 1, decrease oxygen saturation. So again, we're going to be thinking our ABCs. We're going to be thinking expected versus complications. So we're going to be expecting a 2-day-old client to be tiring easily during their feed. They're just being born. They're not really on that wake night day schedule yet, so they are going to be tiring out pretty quickly, especially with this Prioritization fellow. Option 3, sleeps in 2-hour intervals. Again, expected of a 2-day-old newborn. They're not going to be awake for very long. And then option 4, systolic heart murmur. This is an expected finding, especially with the Prioritization fellow, which is a congenital heart defect characterized by pulmonary stenosis, right ventricular hypertrophy, and overriding aorta and ventricular septal defect. So those 4 things compile to categorize a Prioritization fellow. But with a decreased oxygen saturation, this is definitely going to be our main concern. We want to get their oxygen levels back up and always get them breathing at adequate levels. So if a client of 2 days old or any client is decreased oxygen saturation, this is going to be our main priority to follow up on. So you guys did great. That one was an easy one for you. Good job, guys. Let's move on to the next question. The nurse enters a client's room and observes that the client is diaphoretic, lethargic, and disoriented to place and time. Which of the following actions would be a priority for the nurse to take? Option 1, administer IM glucagon. Option 2, administer IV regular insulin. Option 3, prepare the client for a CT scan. And option 4, obtain a capillary blood glucose level. Let me know what you guys think. And let me know as well if we have any recent NCLEX test takers, or if you just passed your NCLEX or registered to take your NCLEX. Let us know so we can wish you the best of luck or congratulations. We had a lot of people who graduated in December and were taking their tests coming up in February this morning. So let me know where y'all fall in that range. If you just graduated, if you just finished taking your tests, if you're an RN, let me know as well. And your correct answers, lots of correct answers in this one. Good job, guys. Great job. We have Miss Noreen on YouTube taking it next week. Good luck. Wish you the best of luck. You got this. You know the information. Jose Ramirez on YouTube as well, taking February 27th. Good luck to you. Okay, great answer choices as well. Correct answer for this one is option 4, obtain a capillary blood glucose level. So priority when you walk into a client's room that is diaphoretic and lethargic. Yes, we're seeing all of this, and we need to figure out what the whole picture is. If you just immediately go in and start administering medication, you might be administering the complete opposite medication that is needed. So in this case, we need to take a capillary blood glucose level to know if we need to give regular insulin or to give glucagon. So that's another way that you can kind of process of elimination these answer choices. If there are two opposite ones, then we also need to realize that we need to assess a little bit more so we can figure out which medication we should do. So obtaining a blood glucose level is like the main step in this nursing process, or the first step in the nursing process. We need to figure out what to do, or we need to figure out what it is so we can know what to do next. So that would be the correct answer. Option 3, prepare the client for a CT scan. If their blood sugars seem to be fine, again, we would need to know what the blood sugar is first. If it wasn't a blood sugar problem, then maybe we would need to see that if it's a stroke problem. So that would be next. So first, we would want to do a quick check of the capillary blood glucose, and then the CT might take a little bit longer. So that would be our next step if it wasn't a blood sugar problem. But you guys did great. Next question. The nurse in the emergency department is assessing a client who has full thickness, 4th degree, burns to the torso and upper extremities. Which of the following findings would require immediate follow-up? Option 1, singed nasal hair. Option 2, presence of eschar. Option 3, 3+ edema of the upper extremities. And option 4, decreased sensation over the burn areas. Which one would require immediate follow-up? So there are a couple keywords in there. Immediate, you already have a full thickness or 4th degree burn. Which one would you go through first? Think expected versus complication. Let me know in the chat what you guys think. And be sure to check out our event page at uworldnursing.com to see topics that we're going to be covering for the next couple weeks for next week. And then you can also join in on our new feature, which is Question of the Week. If you scroll all the way down to the bottom, we deliver a question of the week straight to your inbox, to you personally, so you can do your own critical thinking. And it's just another fun resource that we give, so you can always be constantly learning for the NCLEX. So lots of good opportunities and resources for you guys. Perfect. Correct answer for this one is option 1. We had pretty much everyone on the board saying option 1, the singed nasal hair. So singed nasal hair is a symptom or a manifestation of inhalation injuries. So if you think of if your nasal hairs are being burned, you have to think of everything else on the inside that could also be being burned. So this is an immediate follow-up because you could have an airway and breathing problem very, very soon and very, very quickly. The other options 2, 3, and 4 are pretty much expected findings of someone with a 4th degree burn. You're gonna have presence of eschar. You're gonna have 3+ edema, that is with the third spacing that's gonna happen. And we have to have that fluid resuscitation happen with them very quickly as well. And then decreased sensation over the burn areas. Your nerves are going to be damaged from that burn. So you're not gonna have that sensation that you once have. So those are all expected findings of the burn. But that singed nasal hair, that is going to be showing us an airway and breathing problem very, very quickly if it's not intervened very soon. So you guys did very well on that one. Last question of the day. The nurse is caring for assigned clients. The nurse should first assess the client who, what? Option 1, has pneumonia and a temperature of 100 degrees Fahrenheit. Option 2, has cellulitis of the right lower leg and a heart rate of 130 beats per minute. Option 3, has ulcerative colitis and severe abdominal cramping. And option 4, has history of a stroke and is unable to lift the arm on the affected side. Which one do you think is the answer for this, guys? Drop the answers in the chat. Let me know. Also, since this is the last question of the day, let me know how well you guys are doing today. How many questions out of, we had 8 questions today. Or if you joined in late, how many questions did you get right out of the many questions that you did take? Let me know in the chat. We always want to get better. Progress or practice makes progress. We're not expecting perfection, but we just want you to do well. So, lots of mixtures of answers for this one, actually. This one might have been a little tricky. I'm leaving you guys with a trickier one. And some good answers. We got some 3s, some 1s, and some 2s. Correct answer for this one is actually option 2. So let's break this down. First, you're thinking ABCs, and most importantly, you're also wanting to pair the condition with the complication. Is this an expected finding? And if there's multiple risk factors or symptoms, is it getting increasingly worse? So option 2 has cellulitis of the right lower leg, which is an infection, and then a heart rate of 130. This is showing that things aren't going well with that circulation probably. So we would want to assess that first. Option 1, pneumonia and a temperature of 100 degrees Fahrenheit. This is an expected finding with an infection and pneumonia. Ulcerative colitis and severe abdominal cramping. Again, an expected finding for ulcerative colitis. And then option 4, has a history of a stroke and unable to lift the arm of the affected side. Again, a residual effect and expected finding for someone that has a history of a stroke. Option 2 is the one that's showing the acute things happening right now that is not necessarily correlated. If you have an infection, yes, you're gonna have a fever, but your heart rate shouldn't be going at 130 beats per minute. So we would want to assess that person first. So you guys did pretty good on that one. Thank you guys so much for joining. I hope you learned such good things about prioritizing your ABCs, your standards of nursing process. Tune in to us next week as we do another lecture on Tuesday and another question drill on Wednesday and Thursday. But I hope you guys have a great week.